to Harry McIntosh, who's the one who developed this software, did the software for COA, and then developed Workshop Wizard as a software as a service. And Chris, I'm not sure you guys even met him when you were up in Denver.
I don't think.
I think I.
Okay, well, he's the guy who's going to be doing if we have programming changes that we need to do. He's your guy. So Harry, say something brilliant to everybody.
Something brilliant to everybody.
Perfect. Okay.
Hi, Harry.
Hi.
So you all have gotten a chance to, now you've heard the voice, but he's going to be online in case there's any questions that that come up of a programming nature. But how this will usually work is that Joni and I will walk you through things, and then Kelly, who's on the line, and Mary Pat, who's going to be on the line if she's not already, they're going to, hey Mary Pat. So they're really going to be the team that's going to answer most of the questions, and then if it comes to a programming or a software issue, something like that, then we bring Harry in for that. But I wanted you to at least know he existed. So
I'm not just a rumor. I do exist.
See you in the.
I don't know if you can hear him, but he says he's not a rumor. He does exist. So what we thought we would do today is that Joni would just walk you through how Workshop Wizard works with an eye toward the fact that this will be your site and what you will want to be doing with it. So what we'll show you today is New Mexico's, we'll work with a demo site, and then once you are ready, we will set up a site for you that's actually a live site, and from that point on, it's your data, real data, on a secure site. And but right now, what we're going to walk you through is just pretend information. So you will see that there isn't a lot in there, so it doesn't work quite the same way as it will once you have thousands of records in there. But it will definitely give you a feel for how everything works. And so we're going to try and get through a lot of information, and so hopefully we won't go too quickly, but if we are and you have questions, please stop Joni, and we'll do our best to answer things.
Great, and Lindsay, this is Mimi, before I get started, I just want to make sure that, see who else from DPCP is on the line. So we have all the Albuquerque people, but I just wanted to know if Sue, Harry, and Vanell and Judith were on the line.
I'm here. It's Judith. Good morning.
Okay. And is Sue there? No. Okay.
She's on.
She is on?
She was on.
Yeah, it showed she was on, and then it looked like she left. So.
Yeah.
Okay.
Yeah. Now she's looking like she's muted to me.
Yeah.
Okay, so maybe she's on.
Okay. All right. I just wanted to double check.
Okay, wonderful. And so we think we have everyone.
I guess we're just missing Vanell.
Well, she's on too.
But it shows her on.
Yeah.
I think she's using her mic on her computer rather than calling in, perhaps.
Okay.
Got it.
Okay, great. Thank you.
Okay, Joni, it's all you.
All right. Well, hello, everybody. Hopefully at this point you are seeing a blue and white screen that says Workshop Wizard with the user ID and password information. Is there anybody that's not seeing that currently? All right, wonderful. Well, this is going to be our login page. Once we've set up our key administrators on your end, you're going to be able to give access and unique user ID and password information to the people that you would like to have access to the different functionality in Workshop Wizard. And again, Workshop Wizard is our software as a service. And really, we're going to use this to track our workshops. We're going to use it to track our contacts, class information, referrals, and any type of enrollment. And we're going to be able to run reports using this the software as a service. So for the point of this demo, I'm going to log in as myself. All right. So this is going to be our uh-oh. Can everybody hear me okay?
Yeah. Yes.
Okay, wonderful, wonderful. Okay, so we're going to start basically at the top. Whenever you have your user actually log in, this is going to give that person's information. So if there was information for Joni entered in here, we would be able to find out which classes I've taught or been certified from quickly just from this, this button here. I'm going to start really, though, with our functionality from our Find area. Now, our Find area, this can be used in a few different ways. One, it can be a good way for us to be able to see all of the functionality of the Workshop Wizard and how all the different areas of functionality are interconnected. In addition, you can use this as a quick search function or a quick edit function if you need. So all of the boxes that are represented here are also going to be represented for us over here in the left in the green. So I'm going to go now to our People section. And in our People section, this is really where we track all of our contacts. This is where we're going to track our facilitators, our teachers. This is not where we track our enrollment or referrals. So these are going to either be key contacts with your organization, or these are going to be people who you have trained who are going to be facilitators. So I'm going to do just a general search here just to pull up some information. And Bob is actually who I was going to enter in as our new person. So I'm going to delete Bob real quick. All right. So to start off, we would go here to enter in a new person just by going down to the blue function down at the bottom with the Add Person. Now, one thing you always want to remember is once we've started adding a person, we always want to go to Save Changes. If we are going to delete someone, the program, the software will ask us more than once, or will ask us at least once if we're sure we want to delete, so we can't just accidentally delete. So I'm going to put Bob in here, and Bob's just a made-up man, I hope. I'm just going to put in, actually I'm going to leave this blank because I'm going to come back and show you how this organization connects to Bob in just 1 second. And then I'm just going to add just a little bit of info here for the sake of putting it in. We would obviously fill in all of Bob's contact information once we have that. And then we would want to mark what kind of people or people type that Bob is. If you look over here to the left in our green, this is where we can manipulate the types of people we have over in this section. So I'm going to mark Bob as an organizational contact. So like I said, we're going to come back and look at the organization once I've set that up. I'm going to make him a site contact. And I'll go ahead and just make him an active leader. So I'm going to go ahead and save Bob's changes. And now you can see Bob is located over here in our left screen. Now if I went back to our search function, I could search Bob by a few different ways. I could put Bob's first name in and have Bob come up. I could say I would like all the active leaders that are currently working, that we currently have listed in our Workshop Wizard, and Bob and everybody else who's also an active leader. I can also go and say that I would like to find all my organizational contacts. And we should have that pull up also where Bob is in here. And so we're able to really kind of hone down different ways to search for each person. Now again, looking over here at the side, over to the right, we can add different types of people. So I'm going to add a different type of person. I'm going to actually add a volunteer type.
Hey, Joni?
Yes.
Hi, this is Chris. I have a quick question.
Yes.
if that's okay.
Oh, absolutely.
So on your list over there on the side there, you know, where you have all the different types of individuals that we would check off, I noticed that you have inactive leaders there. Now, does your workshop wizard, I know it tracks like the leaders and how many classes they've taught specifically for the Stanford programs. Will that generate a list of folks, if we click inactive and we want to look at all our leaders that are in the database right now that are currently inactive, would that give us that listing?
It absolutely would. Yes, it absolutely would. And so,
okay, great.
Actually, yeah, and I can go back and show you that in just 1 second. So here I'm adding volunteers. So in that same area that you were just asking about, if I go back to people, I now have volunteer as a choice. Now, I'm not sure if we have anyone already added as an inactive leader, but if we do, then we say search, it should pull up. So we don't currently, but we do have active leaders. So let me just go ahead. This is going to be anyone who's active leader. So if
Joni,
you
can I
ahead
interrupt for a second?
Oh, yeah, please.
I just wanted to clarify for Chris, there will be a way you can search in terms of the certifications, and we'll show you that a little later, that would give you the list of who is inactive, but there's also a checkbox that you can indicate that someone is inactive in the sense of they're going to stay, sorry, that's my dog trying to join the conference call, but you can also have a checkbox that you can use to pull. But this would require, using the checkbox would require you manually checking that box on the leaders you wanted to pull up that way. And later when we show you how you can run certificates, that's another way you can pull it up as well.
Perfect, thank you.
And so, Chris, just for the sake of argument, let's say all of our inactive leaders are active leaders, just so I can show you the list that can come up. So say you had gone in and you click that. So we would pull up, everyone's name would actually come up, and then you would get the choice of being able to print the list of people who are over here in your left pane. And so this report is ran in real time. And so
wow.
you could do this in the exact same way with the active leaders like I just did with with inactive leaders like I just did with our active leaders.
Wow, this is really great because I think this will make a tremendous help to our regional partnerships and partners if they can pull off a list of people that are in their community or region that can do NDPP or CDSMP classes.
It does make it makes it quite powerful. It also makes it very nice. Not only, and this is kind of now we're going to go back to what Lindsay was just talking about, but if we need people to be able to run who needs fidelities or who might need to get in before their certificate expires, we can go down to this area under certified, and I can look up anyone who maybe is going to have a certificate that expires in the next 12 months. I search that. Actually, I know I put somebody in here for at least 15, so search that. Let's try a little less. Well, I will put someone in there. So we're going to go back to our Bob real quick, and we're going to actually give him a certificate. Am I in the right place? Oh, sorry. Okay. So as Bob has been trained, and we want to track what he's been trained in, and we also want to track when his certificate expires or if it's no longer current, and our fidelity. We're able to do this all from this section. Again, we're still under people. And so we're going to add a certificate to Bob. And we're going to say that Bob is an instructor. Let's make him a leader. We're going to go ahead and make him active. Let's go ahead and do it in the CDSMP. And we're going to have him, the certificate expire today, but next year. Okay.
I think it was an invalid date, Joni.
Ah, that would make sense. And as you can see, at least it did put him in as a leader here, or here we go. I'm going to make him active, and hopefully this time I'll get my dates right. Aha. I guess there's not a 206 year.
He's way overdue for a fidelity.
Right. Okay, now I'm going to save that. Yay, there we go. So I'm going to go back here. And now I'm going to track everyone, again, that might have an expiration. And this time Bob actually came up, which is exciting. So if I go back, and I'm going to give somebody else a quick certificate just so we can see this. So again, I'm going to go back and search again for anybody who was going to expire. And now you can see both of us are here. What makes this great is now, again, I can quickly go in and print a list of all the people that I would need to have a fidelity done for prior to their certificate expiring. Okay, so I'm going to go back to our Bob here. And with Bob, so we can, like I said, we can add his certificates, as many as we would like. We can also here go through, and once Bob has actually either facilitated a class, has been trained, or if he has been a fidelity coach for a class, we're able to track that information here also. We are also able to give Bob different levels of access. And so whenever I was saying at the beginning, when we were looking at our login page, we are able to give unique access to each person. And so if I wanted to say that Bob does have access, okay. I'm just going to make this an easy login here. And I find that Bob really isn't going to be working with any of our contacts. I might find that Bob really isn't going to be working directly with our health systems, but maybe Bob is going to be working with some referrals. So I'm going to give Bob full access to that information here. Now currently, if you look over to the side, I have access to all the different levels of functionality. So for Bob right now, I'm just going to give him 3 different areas. I'm going to go in, I'm going to save this, come back out. I'm going to go ahead and log out and log back in quickly here. But I'm going to log in with Bob's information this time. And now you see Bob only has access to this information here. So that's a very powerful part of the Workshop Wizard, is being able to give the right people in the right roles or with the correct training access that they're going to need to be able to be able to either work with referrals, contacts, but also it's going to help us keep our information either HIPAA compliant, or we can have people working in different organizations looking and working just with their organization's information. I'm going to go back in as myself. So
while she's doing that, let me just mention that what you can do then, and we have this in the user manual for you at, under how to get to set someone up for limited access as a leader or instructor. So you can set it up so that if you have someone that, for example, is a DPP lifestyle coach, the only thing they can do is go into their specific area and log the information for the weekly classes. Or if they are one of the coaches for CDSMP, what they can do is go in and pull up just the rosters for their classes. But that way they don't have to have access to anything else except their own class information.
So a couple of questions now. When we start identifying which individuals to give some administrative privileges to, do we got to come up with those usernames, or does your Workshop Wizard generate like a unique username and password to start off?
You would be responsible for coming up with the username and access. The initial username we would be giving you.
Okay.
After that, it would be up to the person you designate as the giver of usernames.
Got it. Okay. And then the other question too. Now, how often do you guys back everything up, or is stuff backed up? Is it not? Does it not need to be backed up because it's on?
No,
it's backed up every night. It's backed up to the web every night, Chris.
Okay, good. Thank you.
Okay. So, any questions currently about what some of the information we've been looking at as far as the People tab goes? Again, we can also, and Chris, I think this is going to be something that's going to be very useful also, is you can search also by curriculum to find out who is a leader who has been trained, and that curriculum has a certificate in that curriculum also. And so there's a lot of different ways to run reports. That's one of the things that will be useful is if you're having some issues with getting the information you want, there might be multiple ways that we can go about getting that information. And so it's just going to be a matter of the amount of diligence you all put into putting correct information into the system, and then really kind of learning the connectivities of it. So again, I'm going to go a little bit further down. If we look down here and under our People tab, we also have our person and where we met through, and you're able to add people to that list just by coming into that tab and pressing add. And we're just going to say Bob, since he's our man today. And instead, this time we're going to go to me and see, we're going to add, instead of Jane, I would like to add Bob as my contact. And I met Bob at the CDSMP conference. And so it's as easy as that to add someone also through our Met Through contact information. Are there any questions under the People area prior to me going on to, I consider this over here kind of more of our organizational area where we're going to talk license holder, health systems, organizations, and society. But prior to moving on, I want to see if there's any questions so far. And can everybody still hear me okay? I'm on a speakerphone, which is always a little strange for me.
Yep.
Okay, wonderful, wonderful. Okay, so our next area, this is going to be where we track our license holders. So, for example, COA has, we have several different organizations that work under our license. However, we also collect information for several different license holders. And so this is going to be our place where we're able to keep our license holder information. Health systems, now these are going to be our larger health systems. For example, I work a lot with Kaiser Permanente. Kaiser would be the health system here, where if we went down, Kaiser Denver would be our organization. So I'm hoping that makes sense, but please stop me if at any point it does not. So for our license holders, we can add a license holder the same way we've been using all of our other tabs.
Joni, real quick question again, sorry.
Yes, fine.
Would we be able to add, you know, this is specific for CDSMP, but would we be able to add something in there that says DPP recognized site or DPP for the National Diabetes Prevention Program, or do we have that flexibility to add those types of fields or information that we need specific for NDPP?
Oh yes, absolutely, absolutely. And so in fact, I'll show you right now. We can even, so if we're looking, we can do something where, so here you can put in whoever. And so now we have New Mexico DPP in here, so Department of Health. But you can change this as many times you can add as many as you would like. Save those changes. And so if I wanted to add another license holder and say we wanted that to be then we can go back through and now we have both of those listed as license holders. We can also put that into the health systems, and the organization is going to be a place where we can also keep comments and information about that. As we move a little bit further down, I'll show you how we are able to include a lot of that information when building our curriculums in our workshops. And I see a question here real quick. Let me see. Yes, we can designate between pending and recognized sites. All right. So once we, again, if we are looking at our license holder, that's going to, again, be the person who is holding the license for that for the curriculum that's being taught. The health system, again, is that overall health system. So I'm going to put in here Mexico Department of Health, just as our health system. And I'm going to make up a few things here, so that's okay. So then again, our organization, this is going to be the different organizations that might fall under that one health system. Okay. And so if you remember, whenever I went in, I designated Bob as an organizational contact. And so now I have the availability of putting Bob into that contact area. So the health system I just set up, I'm just saying that this organization is Department of Health North. And then, of course, we would put all of our information about the organization in here. I'm going to run through that, and then we save our changes. So now our organization exists. We want our organizations may have multiple sites where they're conducting classes. So, for example, COA we are conducting our DPP classes in 3 different locations right now. And so we would also want to designate different sites. So if we went to Okay, I'm going to save that change. Now, when I go back to organization, and I'm going to, and if I click on my New Mexico, now my site exists here under my New Mexico North site for that organization. I can do that for as many sites as I would like. I'm just going to make this one south.
Hold on.
And then again, if I go back, I go to my New Mexico. Did I not save that? Oh, I have to make it under the right one. And there we go. So now the south site also exists. And so again, this is going to be our way of tracking the health systems, the organizations, and sites where we're hosting classes. And which license holder has the license to the classes that are being taught at the different organizations and sites. Are there any questions on this area currently?
This is Judith. I have a question.
Okay.
And you may have gone over this. I stepped out for a moment. What is the most efficient way to enter all this? So, you know, as we're holding lifestyle coach trainings, would it be appropriate for, say, the master trainer to enter all the new lifestyle coaches in, or as we're having a leader training, like, who should be entering this stuff in, and how do you guys generally do it? Is it clear what I'm asking?
I believe so. So whenever we are doing our academies where we would have a lifestyle coach trained, whenever we are getting someone enrolled into the class, then we are actually going in, enrolling them. Our academy director is doing that. So she's enrolling, she's actually going through and putting in their certificate information. Now, if we are putting a participant into a class, then one of our program coordinators is doing that. And that would be down here in this referring section.
Yeah, I'm really talking about our cadre of leaders and lifestyle coaches. So that would probably be maybe the master trainer or the master trainers, right?
That's correct.
Does that make sense?
Yeah, it could be your master trainer. It depends on how how the relationship with your master trainer is. With ours, our master trainers pretty much just come in and teach. And so our director of our academy, who does all of our training, she usually enters in all that information.
Okay, so that's the conversation we need to have here. Okay,
exactly.
Judith, one of the things that we had talked about was the possibility of loading some of the information in for you if it was already existed in spreadsheets. So that is definitely a possibility to give you a little bit of a head start. The other thing that I would suggest is we send out when we send the user's guide, there's a little quick start guide, and that quick start guide walks you through, if you're starting from scratch, which pieces you might want to start. So it may be that it'll show you how you want to set up people, what you have to get in terms of the trainings, and just how to get going very quickly. So I would suggest that piece too.
Okay, thank you.
Sure.
Okay. That was a good question. Any other questions? All right. Well, this next area is where we're going to set up our curriculums and our workshops. When we think about curriculum, think about it as the overall curriculum. So diabetes prevention program, CDS&P, and our workshops are going to be the actual workshops being conducted. So if we have the diabetes prevention program, the workshop would be our workshop we're conducting at Green Mountain in Lakewood. And so I'm going to actually set up this curriculum with DPP. I'm going to keep it currently as a student type as public. Now, though, if I was going to set this up as a basically a train-the-trainer, we were going to train a lifestyle coach, you would switch this to instructor. So I'm going to keep this currently just as public because I'm going to want to enroll someone in it in a bit. And I don't have to fill in any of the certificate information because this is for a public class.
What's the protocol field?
Say it again, I'm sorry.
The protocol, that field that you just clicked on right there, what is that for? It has other DPP. What is that field?
Yeah, let me, real quick, just let me see if this.
The reason we have that protocol is that that is what enables us to know when you're setting a class up that it has, that we need to do the tracking of the weekly diabetes prevention program collection, and also that it that we're going to be collecting different data. So the protocol means the protocol for the student or the protocol for the leader. Right now, there's the only set option is for diabetes, but we collect different information for the diabetes prevention program participants than we do for any of the other programs. The thought is, long term, you may also have other things that we'll need to add, like a falls prevention protocol, or one of the states is doing a hypertension protocol. So that means that that for this particular curriculum we're setting up, we have special things that go with it.
So is that anything that we would have that field? Then it sounds like it's automatically populated as we enter programs in, so we don't really need to worry about that?
The only thing, yeah, all you would need to do at this point is if you were adding something like a chronic disease, the only thing you have to worry about is if it's a diabetes curriculum, let's say you're doing DPP and then you want to add in the Spanish DPP, you would just want to make the protocol DPP for both of them, and that's the only thing that you would need to worry about. Any other additions that we would do under protocol would be coming with programming things as you were adding variations of information you were collecting and other curriculums down the line.
Okay. Did that answer your question?
Did I answer your question, Chris?
Yes, thanks.
Okay.
Okay, so I'm also just going to go ahead and set up an instructor class also. And here, it's going to be something where I'm training an instructor. Again, I'm going to want to have all of the requirements of that certificate put in.
And you're going to do the protocol as DPP too. You got it. Thanks.
All right. So now, again, I have those two overall curriculums. Now, if I'm going to go in for a workshop, I'm going to set up a workshop. I'm going to just say add a workshop. And here I'm just going to start going through and putting in all the information that is being requested for the workshop.
So this means, you all, that you can set up under separate license holders. You can have multiple curriculums under multiple different license holders. So you can get as specific with your record keeping as you need to within the database. So you won't have to go back and hand maneuver things. And then this is the information that once it's in the system, eventually will get pulled through to your public website. But right now, it's really important to capture everything so that you can share that information and make sure that you're tracking everything from the get.
Wonderful. So again, I'm just kind of going through and putting all the information. So again, like Lindsay said, that we're able to pull up any information and will go directly to your website. Here are internal contacts. So this might be something like you need to speak to Chris before registering someone, whereas the website contact comments might be something like the class is free to the public. So we want to make sure website comments, those are going to be something everybody sees. Internal comments are going to be things that only those with access are going to be able to see. And so then I would save changes there, and now I have a class beginning on November 20th, this Friday. So if I come in here, I have a few different ways that I'm able to actually search for classes. So if I click on DPP now and said search, it pulls up the class I just put in. We can also search classes all by site. I believe I put this one in North. There we go. And you can search by date.
Hey, Joni.
Yes.
This is Mimi, and I'm following you, and I'm getting very confused, and I think part of it is because, so I work specifically with NDPP, and the vocabulary, I guess, so to speak, is very different than the MyCD, the CDSMP stuff. So like in this situation where you are right now with the workshops, it says license holder, COA, curriculum, DPP, site, is, the New Mexico DOH North. And I guess what I'm confused about is with NDPP, like there is no license holder. It's all by sites. And so I guess I'm confused as how this would be put together, like, I'm just thinking like with Sue Perry, like she's City of Santa Fe, and that's the site, but there's no license holder. Do you know what I'm saying? So
yes, absolutely.
And so I'm very confused, like how this works, because it doesn't seem like how it would work specifically for NDPP.
So I
situation.
Okay, yeah. So I definitely understand what you're asking, just because I do a lot of our work with the NDPP also. Here for license holders, you could leave it blank. Because there isn't a specific license holder. You could also look at it from who would be receiving the recognition. So if you have an organization that maybe has multiple sites, but that one organization would receive the pending recognition or recognition, they could also be entered in as the license holder. Okay,
because right now, I think there's one site that has maybe multiple arms underneath it.
Okay.
But for the most part, it's like the site is also the recognized site. Does that make sense? So it sounds like we can kind of alter it, and we don't need to put something in there if there isn't one, but if it is a more complex site, then we could put them as the license holder. Is that kind of what you're saying?
Yes.
Okay. Okay, thanks
Yes.
for clarifying.
And you're totally right on that, and that's one of the differences between the curriculum is that it is so site-specific. That's when we would really want to get down to the health system organization and site information to go with the NDPP information. So is that answering the question?
Yes.
Okay, wonderful.
So Mimi, what you can do, Mimi, is start out very simply with very straightforward, no license holder, setting the curriculum and setting the specific sites, and the site might also be the organization. And then as you're building in more sites, more different folks that are in process of getting certification, then you can expand on what you already have. So so it doesn't have to be very complicated in the beginning. It can be very, very straightforward, but you'll have the opportunity to add different branches of things and different connections as you need them.
Okay, good. Yeah, because I guess, you know, I think one thing as we're going through this, one thing I'm concerned about is it's like I don't want us to get too bogged down in the details and make it overly complicated for ourselves and organize it in a way that maybe doesn't, you know, we would want to change later. So, and yeah, so that's good to hear that we start really basic, and then as we need to, we can boost it and organize it, you know, in ways that we see better.
Absolutely.
And I totally agree. And part of what Joni and I'll be working with you on is where to start and which people need access and need training on which areas. What you guys are getting today is sort of everything all at once, which is kind of like, that's probably the most difficult way to see it, but we wanted you to get a feel for everything that was possible within the site. But we've talked about, for example, how we need to discuss with, for example, lifestyle coaches, exactly what they need to know about tracking people that are in their classes on the site, and that's kind of a separate segment of training. And so not every person will need to know all of this. They'll need to know what they need to know to work with the system. And so we definitely are aware of that, and we don't want to overload folks. So your question is perfect and perfect timing, because there's no point making it more complicated. This is designed to help you, not make it crazy.
Yeah, and I'm glad to hear that you guys will be helping us, you know, kind of figure out how to best implement that. That sounds good.
Good, good.
Yeah, and what's nice about that, Mimi, is that we have the programs that you are currently working with. We are currently entering data for those on our end. So you get to get some of the, you know, information, best practices that we've been working with already to be able to really implement this properly. And again, like Lindsay was saying, this is a very broad functionality overview so that you kind of get how robust the system is. But you and I will definitely be talking about how to really keep it simple.
Awesome. Thank you.
Certainly. Okay. So I'm going to move, unless there's any other questions, and please continue to stop me if there are. Move into this next area, and this is where the program coordinator, we start to get kind of excited. From here down, we have how we're going to basically, I consider this kind of the enrollment area, but we are able to track our referring entities, our referring individuals, and actually the referrals coming in. Referring entities, look at that as kind of like the overall maybe practice. So this might be, if I was working with Kaiser, this could be Kaiser North, whereas my referring individual might be Dr. P from Kaiser. There we go. And this can actually be anything. So a referring entity could also be that we are receiving referrals from a recreation center. So you could put the referring entity as a recreation center. So I'm going to kind of keep it general for what we've been working with here. North, our health system. Again, I'm going to save that. When I go to my referring individuals, I want to add a referring individual. Bring Bob back out. All right. So now when I go to referrals and I receive a referral from a practice or a rec center, someone may have called in, and this is usually our program coordinators entering in this information. Basically, all we would say is that we want to add a referral. And we're going to say that Bob referred the person who referred the individual. We add all that individual's information in so that we could call them back if we needed to. What we like to do at COA is also we give reminder phone calls prior to classes beginning. And so making sure this information here is very, very helpful. And then we can either enroll them in a class, or it's just a referral that's come through and they currently can't be in any of the classes. I might put something in here that needs a class after the new year. But I can also go in, and this is also one of the things that I feel is very important, is that we want to make sure that if there has been any type of past communication, that we enter that past communication in here.
I don't think you have the ability to set a handler.
That would be why.
And so that's why you're not able to pull that one up.
Okay.
So when you guys are ready to start tracking referrals, this is probably 2 or 3 steps down the line. This will all, then it becomes basically a contact management tool is what you're doing, so that you're showing and tracking all of the incoming things, and also so you're able to track all self-referrals. So self-referral becomes one of the referring entities, meaning rather than this health system or this practice or this master trainer, you can put up self-referral as one of the sources. And then from that point, you can also track what happens with all those folks. Do they immediately go into a diabetes prevention program, or do you need to follow them and talk with them several times before they enroll? And then from this tab also is where you're going to be able to, as Joni can show you, pull the information that you send back to the referring entities to let them know the contact you're having with their referrals.
So whenever we want to do that, we're able to basically go in, and if we are looking at a referring entity, and I'm not sure if we have, I know we don't have anyone under self. Let me see if this one. Then, as you see, Tim was pulled up, who we just entered in. So if we've received quite a few, every week, sorry, let me step back. As a program coordinator, whenever I'm receiving referrals from a practice or specific provider, I like to send them a referral log so they know what the contact has been like, and so that we're able to share that information. And so to do that, we go to print, and it's going to pull up all the information about who has been referred under the New Mexico Department of Health North area. see if I can find one that has more people in it. So there we go. All right. So now if I wanted to send this referral log to Briargate Medical, because they've been sending us in referrals, I'd say print. So everyone that they have sent me information about, I'm able to fax them over a log that shows them whether or not the person has been enrolled, and will also track their past contacts and their address and information in that. So that makes for a really quick report to be able to share with practice providers, with other organizations, people that are sending in information, or just to be able to run a report of how many people have been self-referred.
Joni, we've got you set as a handler now.
Oh, yay.
Just so you know.
Okay. Thank you.
It's the magic of operating on 2 screens at once.
Let me see. I'm going to go back to the reason why. So we see Tim Jones again. I want to pass contacts. I'm going to add my contacts. I think this is okay. Now that information should now show up over here, so that if I ran that report or wanted to send this back to a provider, that they would be able to talk with him. Hey, I hear you wanted to talk with your wife. Did you talk with her? Are you going to join the class after the new year? And it's just a good way of really closing, having that feedback loop, making sure that you're really communicating with providers or with other entities that are referring into your classes. All right. Once we go down and we have entered information, this is where under our participant tab that we're going to enter in our different information that we collect. So this could be demographic information. For DPP, this is where we're going to collect our minutes of our active minutes and also our weight for our weekly weigh-ins. And all this information gets collected here. Basically, same kind of way. You fill out everything and save it. So you would just add a participant. And then, again, where we then get to use all that information is in our Reports tab. And our Reports tab, we can process reports in either with either 1 or 2 columns. I'm going to go with 1 column for right now. And I'm just going to call it and I'm going to say that we want to look at all the curriculum only for Strong Health at Santa Fe. That's the location where we would like it. Run next. And this is going to run me a quick report of the workshop that was there. Now, this is great for a few different reasons. One, it's going to give us all that demographic information that we've been collecting. Two, it's also in Word format. And so if we need to make footnotes, have explanations, carry out actually add our logos, we're able to do all of that. And so this is a form or a report that we can manipulate quite a bit. I'm going to show you real quick while we're here, and I know a few people are going to have to get off. I'm going to create another report. So I just wanted to show you how this can be used to compare and contrast.
Yes. Next.
So I'm still going to keep all of the curriculum, and I'm going to say only the following organizations because I just want Santa Fe in this column. Okay, next. Next. And then I'm going to say all others here. I still want all the curriculums. all of them except for this guy, because I'm comparing against the Santa Fe. I'm going to say next, next. And kind of go and click through there. You can save these configurations also. I love this. Yay! So now we can see that compared to everyone else, that Santa Fe has had 1 workshop compared to 5. We've had 63 participants versus 20. And so we get a breakdown of all of that information right here, again, that you can manipulate in a Word format. And
Joni, can you hear me?
Yes, I can.
Okay, this is Vanell, and my question is, I noticed that you are very meticulous about making sure you have correct entry in there. You know, Santa Fe was capitalized. So if somebody should not do that, will it carry on, or does it self-correct?
Oh no, it would go. So if I had left Santa Fe not capitalized, it would come out lowercase here also.
But I mean, it would not change the trajectory of where you're going. It just kind of self-corrects and keeps going.
That's correct.
Okay.
Case sensitive. Any of this stuff isn't case sensitive other than, right?
You're going to need, like, it'll show up on the Word document needing you to manually fix it, so it won't auto-correct capitalizations and things, but it will still work. It'll still run the report. You'll just have to look at it and correct it on the Word document.
Good. Okay. Thank you.
And
yeah,
just
certainly.
so you know, we will be doing trainings on specifically the reporting features as we move forward, because there's just a lot in there, and that's part of what we've built in some programming time. So as we move forward with this, if there are some changes we need to make programming-wise so that we get you the reports you need, we will do that. We have that in there.
Okay. Which, for those who are going to be submitting for the CDC, you're going to love this for the DPP. And so that, again, was a very, very broad, here's all the functionality at once. All of these, you know, that's part of what you get out of me, is that I'm going to be helping you get going, setting this up. We're going to keep it very simple, because there are a lot of connections. And once we start to really get into the connections and the information, you're going to see how we can pull data in several different ways. The big thing kind of going into this is just knowing that this system is only as strong as the data that's put into it. And so we just want to make sure that, you know, the right people that are putting in the data are making sure the data is being entered correctly. Which down here we are able to actually track some of that, because we actually have a log that can help us understand who's been in their last, what they've been doing, or if someone says, hey, the system just isn't working, and we go on the log and they haven't been on it in the past 6 months, we're able to kind of check out and see where some of those issues might be. So, but are there any other questions?
Well, so this is Mimi, and thank you for the walkthrough. I think I know my head's a little blown right now. That was a lot of information, but I do have, this is, I guess, a more logistical questions on our end. So we have a lifestyle coach training that our master trainer and I, Sue, are in the process of trying to put together. And what we're doing is we're making it now, instead of 2-day training, we're making it a 2.5-day training. And the half-day, part of it is going to be about data and entering data and using reports and, you know, evaluation and things like that. And so anyway, so what I'm wondering is, you know, and maybe we talk some other time more specifically about this, but we're in the planning stages, and we just don't know how we would go about doing that, because we want to talk about this piece, and we don't know if maybe Sue or I would walk through it, or if you guys would do it, or what. And so I think that's something that we definitely need to talk about. Does that make sense?
Yes, absolutely, absolutely, and that's actually something that I just went and did my Master Trainer Select, and they talked quite a bit about, you know, being able to have a part of the day for data information. When did you say again that you were looking to be doing the training?
Well, right now, nothing is set in stone yet. We are trying for early January. That's what we're trying for, but I also want to just keep, you know, I want that to be flexible in case that, you know, I want it to all line up with what works best for everyone's timeline, if that makes sense.
Yeah, absolutely. And that, I think that's something that maybe that's one of our first next steps is kind of how we would like to go about this first training and sharing that information and kind of what the key information we need to share with those lifestyle coaches would be.
Okay.
You know, Mimi, Joni and I talked about that we wanted to record kind of a walkthrough if you were a lifestyle coach and your only task was to go on and record your information once your workshop series had been set up.
Yeah.
But your job was to go in and plug people in. What would that look like? So, Joni, I'm thinking now would be a really good time for us to record that piece and make it available to Mimi so that Mimi can see, you know, what some of the moving parts would be, and that might help as she's trying to formulate what all curriculum-wise she wants to do.
Yeah,
I like that.
That would be a huge help, actually, and then that way, you know, Sue and I can look at it and, you know, and then also our evaluator look at it, and then that way we can kind of figure out the rest of that half day and what it would look like and everything. So that would be excellent, and that could be something that we could play, you know, for the lifestyle coaches.
We don't want to overburden or over confuse them.
No.
Because
and what would be great about that is then they could also go and access it at any point.
Okay.
If they were confused, or, you know, they were trained and then they didn't start really teaching a class until almost 11 months later, type thing.
Right. Yeah, that would be great.
We can also pull out the parts of the user's guide that are specific to that area. We have that set up that way, and so the idea is we can pull that section out so they have just what they need in terms of instruction manual too. So I think that would be real good.
Yeah, those all
sound. And just keep in mind, you guys can get on and log on and play with this, because until we go live, this is just all pretend information. So I would suggest go into the People tab and put yourself in and take yourself out and move yourself around and just kind of play a little bit so you get familiar with just some of the basics and how the website works. And that will help your confidence level and also help you just get a feel for how things, that basically you tell the system what you're going to do, you do it, then you save it, is how it works.
Right.
Great.
And as Sue said, Mimi, and I'm sure you noted this on the question, is you're going to need to train all the active NDPP people now, and I don't even know about the CDSMP people, Chris. How you're going to do those training sessions. You're going to have to logistically figure that out.
Yeah, you know, I think it's going to be more. It's going to be more with our master trainers taking on a lot of this.
Yeah.
That's what I'm thinking right now. It's just easier when they finish the workshop trainings, the leader trainings, for them to just enter those people that successfully achieve their past the 4-day training, and then they have to do the master trainers have to follow up with them, because even though they finish the 4-day training, they haven't achieved full certification. They have to actually facilitate a 6-week workshop. So I think for CDSMP, it's going to be the master trainers doing a lot.
Yeah, but what about the active ones, the ones who are now, to get them in the system, are you going to have like a start date?
We're working on right now. Yeah, we're updating our list right now in an Excel spreadsheet that has everything that we'll be able to work with Lindsay and them to give to them.
Right. Super.
Mimi may have already gotten with you. Is there a preliminary type adding me? Because I think I was out a couple of weeks ago with surgery, but if you all could add me, that would be wonderful.
Yeah, she needs a username and a password, so if we could get that to her, that would be excellent for her to be
And
able
is this Timpa?
Tempa Tate, yes.
Okay, wonderful. I will get that to you.
Thank you.
Wonderful.
Well, this is an awesome tool. It's going to be exciting as we try to nail it down and play with it and make it work.
So I'm wondering, this is Mimi, I'm just wondering, so what are the next steps now? Like what comes next?
You all are going to let us know when you have a spreadsheet so that we can load the data for you, if we're going to do that. And then you need to let us know when you are ready for us to set up an official live site. And what that means is then it won't be a matter of us putting in pretend information and moving it around to demonstrate, but that's your real live site that will have your information and potentially protected health information. And so at that point, this is like show and tell. We can set up that live site at any point in time. So that would be probably the next step. The other thing we may want to do, Mimi and Chris, and I'm not sure who else would be involved, is set up a time to kind of talk on timelines. We had talked about trying to figure out when we wanted to do that. So we know a little bit more about what you've got in mind, because I think you're right that there are some different training pieces in terms of us recording some things for you and figuring out who we want to include when on things. So I think those would be the next step.
Okay, and we also need to meet with our evaluator to talk about evaluation as well.
Yeah.
So that's another, okay. So I know that, I mean, can we go ahead and schedule something for the evaluator and you and I, and then to do the evaluation, and then maybe we can figure out the timeline and when we can meet that? Chris,
I think that's perfect. Okay. And in the meantime, yeah, and in the meantime, we can work on spreadsheets, and we can work on when you want us to go live, and what URL you want for the live site. So and so I think we can do that, and then Joni and I can work on recording some things.
Great. Okay. So and I'm also just wondering, is it possible, can you guys send a list of like phone numbers too for me to have? Because I know sometimes I like email, but it's also sometimes nice to touch base in person. Would it be possible for me to get that? This is Mimi, sorry.
Absolutely.
Okay, great. Okay. So I will also, so I have a list, an Excel spreadsheet already of all the master trainers, and I will go through that and look at that, but send it along to you and see if it would be, you know, if it's something that you guys can work from. And then I know for the CDSMT, they're in the process of compiling that master list for all their trainers. So
DSMT as well, I think, right?
yeah, the MyCD stuff, yeah.
They're usually cross-trained.
Yeah. So, okay. So, okay, sorry, I'm a little overwhelmed. Sorry. I'm having a hard time thinking.
This was very helpful. Thank you.
This was one of our concerns about showing you all of this at once, is that, you know, we've been working with the system since 2009, and so there's a lot in here, and we've built onto it as our needs have grown. So there's a lot here, and so part of Joni's task and Kelly's task and my task and Mary Pat's task is to kind of walk you through it one section at a time so that even though 10 years from now you'll have a very robust system that will be totally mind-blowing, when you're starting, it's something usable and approachable for each group that we're going to be talking with. So that's our goal.
Have to start
That's
somewhere.
great. So can we just, can we schedule a meeting now for evaluation, or do you want to do that via email? Okay, we got to go. Oh, sorry. Chris is saying he has to get off, so we will
Okay.
send an email and we'll
We
figure
will
it out.
be emailing. And we'll send you the link to the recording.
Okay, excellent.
Thank you.
Thank
So
you,
somebody's
Joni.
going to
Great
tell
job.
possible dates, is that it?
Yeah, so now we'll email coordinate.
Okay.
Okay. So
Thank you, ladies. That was really fascinating.
Thank you.
thanks.
Thank you all.
Thank you, Joni. Hey,
Good
Joni.
job, Joni.